Well, welcome back to the next edition of the Benefits Grove. I am sitting here with Stacy Hutton. She is our new benefits lead, and we wanted to spend a few minutes just to chat about HSAs and FSAs. But before we get into that, Stacy, why don't you tell us a little bit about your background?
Yeah, sure. Well, thank you for inviting me to the Benefits Grove. I really appreciate it. Before starting with Arkwood, I had worked at other consulting firms and also on the employer side. So I have a background working as an employee benefits manager for large jumbo self-funded plans, the largest which this was the state of Arizona, right, which covered 70,000 employees. So boy, that was a job.
So you got some questions, I'm guessing, from employees.
Yeah, lots of questions. But I worked for multiple large employers all across the nation.
Right.
Also for a TPA claims administrator
okay,
that paid medical claims,
okay,
and on the consulting side.
So you really know all the different aspects of managing a benefits plan.
Yeah, I call it the secret sauce.
Yeah, so you can peel back the onion and kind of know what to look for, whereas someone like me who's out in the field shaking hands and kissing babies may not know that.
Right, and having the secret sauce, I'm able to help clients and maneuver through some of the strict rules that some of the vendors have. Right. So,
well, let's talk through a couple things. So, we know that we're coming up on a new year, which means that things are changing with limits for health savings accounts and FSAs. Let's spend a minute just talking about the differences between what an FSA is and an HSA.
Yeah, well, I think, I always look to the employee's perspective because right, the objective from the employer and from the HR department is to be able to attract and retain employees.
Right.
So I always look at, from the employee's perspective, when they're going to save money for the expense of their health care, et cetera, they want the most flexibility that they can have.
Right.
Your traditional FSAs only allow you to spend that money for that current plan year, right, and some employers opt to have the rollover option, some don't. So you don't even go into the next plan year.
Right.
And if you don't use the money, you lose it. So that's not very flexible for their employees.
Right. Now, is it fair to say that if they forfeit those dollars, we can have the employer just have a big picnic for everybody without that unspent money?
Yeah, no.
No.
And most of the time, FSAs really do break even. I mean, right, employers aren't making a lot of money off of those.
Yeah, that's not designed for it.
Yeah, it's not designed for that. But I think HSAs offer employees the most flexibility, and they can even save those funds to use in further years and invest those funds.
Right.
And
right,
use them for retirement. So they're really, really a flexible mechanism to enable employers to offer their employees an avenue to save pre-tax money to help with some of their expenses.
Right. Now, so what are the differences in the healthcare plans that allow people to participate in an FSA or an HSA?
Well, you have to have a qualified high deductible health plan.
Right.
So
for an HSA.
Right, for an HSA.
Right.
Yeah.
What does that mean?
Well, well, now we got to start talking about the IRS, right?
Exactly.
That'll take us down a path. But it just
we
means...
can condense it a little bit.
Yeah, we can condense it. It just means that you have to have a certain deductible limit in order to be a qualified high deductible health plan.
Right, and no first dollar benefits. So
right.
You can't have the first dollar copays for visiting your primary care when you have a diagnosis or getting a copay for a specialty or even a prescription drug plan.
Right.
Everything has to go towards the deductible first.
Exactly.
So there is a difference for the members themselves where they need to be willing to participate in that type of a plan, but then you get tax benefits.
Yes.
Yeah, and we typically see is that leadership, ownership, they're usually benefiting the most from these types of plans because they're in the higher tax bracket.
Right.
When we're designing plans with employers, we certainly, from your perspective as well, taking in the employee's perspective where we may not have somebody that is comfortable with coming up with a high deductible as an out-of-pocket expense, and nor will they actually be putting additional monies inside that health savings account. But it's good to have a choice.
Right.
So another question we seem to get a lot too is that can I have an FSA and an HSA at the same time?
No.
Why?
Because they're pre-tax dollars that you're using to spend for the same type of expenses. So the IRS doesn't let you double dip.
Right.
You can't have pre-tax over here for the same thing they have pre-tax over here.
Right.
They don't like that.
Yeah.
They don't like people double dipping.
And it's really interesting if you kind of dig into the language of the IRS, which is comical, because we're always saying, you remember, we do have to make decisions based upon how the government made decisions before us. But the way the FSAs and the HSA languages compete with each other is, in order to be eligible to use the FSA money, if you put money inside that, you have to exhaust your HSA dollar. So it's a competing interest, is that you would never want to put these together, because the whole purpose of using an HSA is to accumulate dollars over time and accumulate an asset that eventually becomes a tax-free distribution.
Right.
For unreimbursed healthcare expenses.
Right.
Asterisk, right?
Right.
Exactly. Okay. Well, let's take a kind of a shift, if we could. We've been doing a lot of communications about the opportunities of moving away from like a fully insured environment, where
Right.
we're actually just participating with the insurance company. There's not a lot of information, and then at the end of the year, we get a renewal that says, well, you had a couple of people that had something wrong with them, and so now you get a whatever % increase. And we've been talking about the advantages of self-funding. So now, with your background and kind of your perspective as working from an employer, working from an administrator, and then from the carrier's type of side, like, where do you see the advantages of doing a self-funded plan versus a fully insured plan?
Well, you get to know where your money is spent.
Right.
So let's start there. I mean, we don't go to the bank and open up a bank account, have the bank pay all of our bills for us. And that's essentially what you're doing when you have a fully
really
insured
good
contract.
Analogy.
Yeah.
I'm
So
gonna have to plagiarize that.
yeah, you can. Go ahead.
Okay.
So when you have a fully insured contract with a carrier, you don't really know where that money's going, and they don't give you any data to support it, to
Right.
show you, hey, you spent this much in premiums and this is how much we paid in claims.
Right.
Right? At the end of the year, when they come to you with that 20% increase, they just say, oh, you had a couple people that got really sick.
Right.
And that's unfortunate, but based on those couple of people, we're going to have to raise your rates 20%.
Right.
So, sometimes they'll give you a loss ratio, but you don't know how that loss ratio is calculated.
Because you don't have any of the supporting documents.
Right. You know how much in premiums you paid. That's
Right.
it. That's all you have.
Right.
So, I think shedding light on where your money's going is a good thing, and knowing where all that money's going. And
Right.
so, when you self-fund, there's a lot of employers who are scared to self-fund, or they get nervous about it because they're not insurance experts.
Right.
But that's what we're here for.
Right.
Right?
Exactly.
So when you go to self-fund, we do most of the legwork. We're figuring out where your money is. We figure out the reporting.
Right.
And we actually give you data that shows you, here's how much you had in claims. Here's how much in fees that you paid, which are the cost of paying the vendor to actually do the process of paying the claims.
Right.
So you have fees and you have claims.
Right.
And then you can self-fund and have whatever network you want to. There's rules and there's guidelines.
Right.
But
Like
you
everything.
can rent ABC network if that's what your employees want, etc.
Right.
So you have fees to rent your network and fees to pay your claims, and then you have your claims.
So from an employer's perspective, is their risk any different? Like, is their maximum liability equivalent to what a fully insured premium would be?
Well, it depends. That's again where the employer has choice.
Right.
Because in a self-funded arrangement, you buy an overarching what they call stop-loss policy that protects you from jumbo claims.
Okay.
But you can set that limit at whatever you want. So especially if you're going into your first year of self-funding, you may want to set that limit lower at like $50,000.
Right.
So any claim for any member that goes, if the spend goes over $50,000, then the insurance company kicks in and they pay those claims.
Right. And so that
So it protects you.
Yeah.
Right.
You don't have that or any erratic spikes in cash flow.
Right. You're protected after that level.
Is it fair? So in a fully insured arena, generally those claims or those premiums and reporting is going to be pooled. So
Right.
they may say, okay, all of my employers that are joining us that are less than 100 lives, you're all in the same pool. And
Right.
then that pool has a risk analysis and algorithms that are attached to it. And then that comes up with rates. And then they kind of fine tune it so that
Right.
if you're sicker than average, you get a little bit higher. If you're healthier than average, you might get a little bit lower. But within reason, you're in a pool.
Well, yeah, that's
Is
what
that
they
fair?
say. You
Well-
still don't know how they divide the money in the
Fair,
pool.
fair.
So if you use that same analogy and there's 100 groups or 100 employers in that pool. Well, what if your top 5 spent 80% of the money?
Fair, yeah.
Right?
Which is possible.
So,
which is going to impact your rates.
It's going to impact my rates, and I may not have spent that money.
So is it fair to say that in a self-funded market or a self-funded policy that the employer that's actually the plan sponsor, their rates are going to be their rates?
Right.
So,
based on their claims.
And their history and their employees and their participation. It's not going to be blended in with any other employer that might be in the community, whether it be higher risk or lower risk. It'll be their specific outcome.
Yeah, and even better than that, it's like, I'll use my bank analogy again. You get a banking statement every month. Well,
Right.
ARC provide you a statement of what your benefits dollars do every month.
Right.
So we provide you with reporting and sit down with you and talk about, here's what your claims were, here's what your fees were,
Right.
here's your large claimants. And then we can also suggest other programs. If you have certain conditions within your group, we can put in different types of medical management programs to help manage that
Right.
expense.
So
but we watch the dollars.
So you're saying is that we can make decisions with information?
Yeah, it's a novel concept.
Now, you talked about looking at, we get reports of high-cost claimants and where the activity is. How is this information presented to employers? Are we coming in and we're saying, hey, David Casanova, man, he's sick. He's got so much going on with him.
No,
and
not
that's
at all.
Stacy Hutton, boy, look at these prescriptions she's on. So does that happen?
Hope Stacy quits in a couple months. No, that's not how it happens. We follow HIPAA guidelines. We protect people's personal health information, right. And there's no real need to know anybody's name.
Right.
What we're doing is we're trying to manage the risk overall. So and also helping members. So back to my, I look at the members' perspective.
Right.
We also have to help those members navigate through the healthcare system. And with
Right.
this self-funded plan, we can do that.
It is a little bit of an opaque system, isn't it?
Yeah, it's so confusing. So we can educate the members and help them, but there are choices that members make. If you have a minor surgery and you go to a surgery center versus a hospital,
right.
You can save thousands and thousands of dollars.
Right.
So we try and help employees make the correct decisions and help direct them according to what their needs are.
Right. No, that's a really good point, because some of our advanced planning techniques that we're using for our clients, we create a relationship with, and we're learning how the employees and the members are actually interacting with the healthcare plan, is that now with this information, we're creating a plan where we're benefiting the member.
Right.
So that if we have a member advocate that is joining in with the inside the ecosystem of the healthcare plan, where if we can have them talk to the advocate before going into the hospital versus the surgery center, if we can save the plan thousands of dollars, and now we're waiving the out-of-pocket expense for the member, which is super important, because, if you look at our average incomes here in Arizona, we're at about $72,000 for the median
Right.
income, and you look at the average policy, we're talking $6,000-$7,000 out of pocket. So we're asking someone to spend 10% of the pre-tax income on claims, which is it's not reasonable.
Right.
And so if we can set this up, or if we can put mechanisms in place, which is what I believe you're referring to, is that we can direct them to a better site of care,
right,
less expensive, and then we waive their out-of-pocket expense, and we're still saving the plan money.
Right, and we also look at quality metrics too.
Oh, that's
so
good.
It's not just the money; it's quality too, because some places are better at knee
so
surgeries.
We're not just going to refer someone to a veterinarian because
No.
they're the cheapest one out
No.
there to do a
No.
rotator cuff surgery.
No, we want to make sure
happen?
they don't end up back in the hospital also, right?
Right.
Because that's you don't want things to reoccur, etc.
Right.
So we look at quality metrics also when making those decisions. And really, you mentioned the word advocate, right? Which is a newer term in the market. This isn't any different than people have been doing for ages and ages and ages. Every time you had a surgery, you had to call somebody.
Yeah,
we're just saying we're just saying call the person that's going to partner with you.
Right.
Right.
Mm-hmm.
We're not calling a fully insured carrier that is going whatever direction they give you is going to benefit their pocketbook. So
that's a very aggressive statement.
Well, it kind of is.
So, let's talk about the pocketbook for a second. So, if I'm paying a premium dollar,
Yeah.
how much of that is typically getting reserved to pay claims with inside a self-funded plan?
About 80 to 85%.
Okay. So then, now what if I don't spend all that money in a self-funded plan? What happens to the excess?
Well, the excess stays into your reserves.
Okay.
Right? So usually employers fund They fund by the projections that we make. And so when they have money left over, it stays there for reserves for critical years in the future, but it's still in your general assets. So
it's still part of the employer, it's still part of the plan sponsor.
Right.
So now what happens if we flip that to a fully insured contract? So now
that money goes away.
Okay. No longer available to me. Can't use it in future years.
Can't dip into it. You don't get it back.
Yeah, so it could potentially go to the bottom line of the insurance carrier.
Right. So I don't know about you, but I'd rather manage my own money. Like I said, I don't let my banker pay all my bills and negotiate, what cell phone carrier I'm going to use, right? So I wouldn't want a carrier to just tell me, well, this is how much you spent. We've got to increase your rates and not know what that's coming from.
Right. That's very fair. So I think the summary of the conversation is that we are taking an advocacy approach to managing the healthcare, looking at it from a fiduciary perspective to make sure that you understand where your dollars are going, why they're going there, and are you paying reasonable for those services. So Stacy, have you ever read the book Who Moved My Cheese?
No, I have not.
All right, so that we should have set that one up much better.
Okay.
So, Stacey, let me tell you about a book called Who Moved My Cheese.
Okay.
It's a really good read. It's probably, 60 to 80 pages, but it really does a good highlight of people's resistance to change. It's hard to change. And if I'm, we have an HR consulting firm here, and so if I'm ever talking to one of our generalists, I completely understand why there's resistance to change, because it all boils down to time. We only have so many hours in the day,
right?
And there's a lot of competition for that time. And so then throwing a variable on top of that, where we're asking someone to change carriers or to change a process, that's going to add stress. So let's spend a few minutes just kind of talking through that. What is an experience like when you're changing from, say, a fully insured carrier to, say, self-funding? Like, what types of changes do you think most, number one, members are going to experience? But then let's also put your hat on as from the administrator perspective, is what kind of changes are they going to be experiencing?
Well, so from the employee perspective, maybe nothing.
Okay.
Because you can self-fund a health plan and they can still have their whatever network from whichever carrier that they currently have today.
Right.
So, and
even if they can't,
even if they can't, they can have a comparable network. Most of the big networks have all of the hospitals or all of the provider groups in them anyway. So there's no real
switching
lapse.
from like a Blues to United to a Cigna to
it doesn't really make a difference. And we do analysis on the current providers being used today and look into that. So the employees may not feel anything with the change. From an HR person's perspective, not really much. You still have a dollar amount, that you're loading in your payroll system, that you accrue for benefits. How that dollar amount is built is what changes. So, we do the legwork on the analysis. We present how the numbers are projected based on your actual expenses. Right? We project what savings there could be based off of, if you're fully insured now and you're moving to self-funding, there's all kinds of room for savings.
But that's probably more along the lines of having a conversation with the CFO.
Right.
Or maybe even a CEO, because the CEO wants to make sure he has a competitive benefit package. The CFO understands that there's still only 100 cents in every single dollar. And so, and there's competition for that. But from an HR perspective, if I'm hearing you correctly, really there's not a lot of change for them. They're still going to have the same stability of a strong network, because if we're being honest, when I go to a doctor and the doctor is asking me who am I insured with, they're not asking me who the insurance company is. Right. They're asking me who is your network to see
who's my contract with
the network.
Exactly.
So it's not the question really should be modified, but that's going to be moving a mountain inside our communities.
Yeah.
But the true question is what network are you using?
Right.
And I agree with you. So the networks down here, they're so strong. Switching back and forth. So from an operational standpoint, from the human resources, the folks are going to get a new ID card, and it's most likely not going to have a known carrier that's advertising on TV with a logo up on top.
Right.
It's not going to have that.
Right.
It'll have something on the back, but it's not going to be something that's recognizable.
Right. It's going to be ABC Administration Company, right?
Exactly.
That you want someone independent that's managing your claims, that's paying those claims, right? But they're
Right.
paying them according to the whatever network contract for whichever network you want to use.
We can probably just use names here. Everybody knows we've got.
Yeah, so the claims are paid according to Cigna's contract with that doctor.
Right.
But the person paying the claims may not be Cigna.
Exactly. That's the difference.
So
what would you tell, so the resistance that I would see or I would anticipate from an employee is that, well, who's our insurance company? Because again, it's the network conversation.
Right.
But then it's also going to be like, who do I call? Like, is this discount insurance now?
Right, exactly.
Right? Because I don't have a logo.
Right,
So that can add stress and that can add disruption.
Right.
So what would you tell an HR's, someone in the HR's field perspective, and what answer they would give to their employee?
Well, first of all, we're there for you. So we're going to come out and we're going to help educate your employees. That's number one.
Right.
So for open enrollment, we can do a myriad of things. We put presentations together. We can do recordings. We can do in-person meetings, whatever is more comfortable with. But so they call us because we're going to help them.
Right.
And we're going to educate them on, here's who you call for a question on your medical claim. Here's the website that you log on. Just like if you have a Cigna
because we all have
or the
phones
app.
now.
Everybody, they all have apps.
Yeah.
They all have websites. It works the same way. Their name just isn't Cigna.
Right.
Or United Healthcare or whatever.
Or Blue Cross Blue Shield.
Right.
So I think the summary of this question is that there's, from an employee's perspective, there's really no operational change, because if we're using a Cigna-backed network, then it's Cigna's contract that actually is going to be with the provider. It's not the insurance plans. Or if we're using a United Healthcare network, it's United Healthcare's contract.
Right.
So we're just talking about changing out the administration, maybe the pharmacy manager, and then also some of the education and medical management tools. So from an employee's perspective, there's really not a lot of change, because they just have to know, how do I search the doctors to make sure they're contracted?
Right.
And then from the employer's perspective, it's really just giving them the tools so that when someone calls up and says, I don't understand our insurance,
Right.
well, we have an app that houses all the information, or call Arkwood if you don't have any, if you have something that's unanswered.
Right, exactly.
So their life really should not change.
Right. And from the HR person's perspective, it's most difficult for them going through the process of educating when they think of change, right?
Right.
It's educating their employees from calling this number to calling this number, right? And we're going to be there every step of the way.
Right.
Right?
Right.
And, we're going to help them through, here's what the bill looks like, right? Because you're not paying one premium, right? But other than that, it's really the same old thing, except you get more information.
Because you're getting more information, we're going to teach them how to ingest this more information that's coming their way.
Right.
Okay.
Exactly.
Well, there was something else I wanted to bring up too, but it flew out of my brain. So we can do advocacy, but then we were talking about self-funding, less disruption. Oh, I know what it is. So something else I would probably want to chit-chat about when we're talking about change is the best time to sail a boat is probably during nice weather.
Right.
And so when we are looking at changing carriers, typically speaking, it's fair to say is that let's do it on a good year. Right. So if we're ever in an environment where we're working with somebody that has, a fantastic, quote unquote fantastic fully insured renewal of maybe 2 to 5%, that's when to move. That's when to move.
That's when to move.
Tell me why. Why is that the best time to move?
Well, because even in the antiquated process of a fully insured carrier not giving you all the numbers and you not knowing, how much total was spent in claims, right? Where did all my dollars go to? If they're only giving you a 3 to 5% increase, they made money. Right?
So you don't have a lot of stuff going on.
They're not going to give you a 3 to 5% increase if you had an excess spend of 20%, right?
That's fair.
So it's a good year because you haven't ran over what their projections are that keep their profit margin whole.
So though, let's talk about the member experience. So if we're in an environment where we're in a good year and we're getting a low renewal, that means we'll probably have a healthier group. So is it fair to say that now the time to change is now because we have the smallest amount of member disruption because we don't have people in mid-treatment?
Right, exactly.
I guess I answered your question as I was answering.
Yeah, you posed the question and answered it.
Sorry.
But the other piece of that too is that, we've been using the word change, but they're not really changing because if you're still going to go into the same network, even if I do have providers that I currently see,
Right.
the object is to have those providers still in the network.
Right. So let's touch base back on we were talking about advocacy in a couple of different formats, but let's kind of revisit what the advanced planning designs that we're doing right now with an advocate. So from your experience as being an administrator, or actually let's go to your experience from being on the plan sponsor side.
Mm-hmm.
Would it have been valuable to have somebody that was inside the healthcare plan that would pick up the phone and ask members to say, or to while the pre-authorization was going on, and say, I understand you're going to a hospital system to get your MRI done because you fell skiing on January 20th and you tore off 3 of your tendons on your shoulder, but that's a different story. However, instead of having you go to the hospital, let's have you go to this freestanding MRI center, and if you do that, then we're going to waive your out-of-pocket expenses. From that perspective and that position that you were, to say, at the state, would that have been something that was valuable, and why?
Absolutely, because then, first of all, having someone that is being proactive to help employees maneuver through what is upcoming that's priceless. Because people are navigating the healthcare system blind, right? If you have to have a surgery, you have to go see your primary care. Then you got to get referral. Then you've got to go to that doctor. Then you got to get blood work done. Then you got to get an x-ray done. You've got to take all of these steps. Yeah. Most people don't even know. Yeah. And most people don't even know what those steps are. And then when you're in it and you don't know what you don't know. So, number one, from an employee support perspective, and being able to support that employee, get their treatment approved, get them in for treatment, get it scheduled, and get them back to work.
Let's revisit that. Get it scheduled. So you're really talking from a concierge perspective where you now are turning something over to somebody else so that they're going to help get you in the door, get you scheduled, timely, make sure the right tests are ordered. And so you're leaving all that off of the patient.
Right.
Or the patient's loved one. Because clearly, if something is going on with somebody, well, if it's myself, I'm probably not in a position that's a really high stress environment to deal with it.
Right.
And if it's something going on with my spouse or my child, my emotional status is elevated regardless.
Right.
So I'm probably not the best one to be handling that anyway. So you're saying is that an advocate really has the potential to reduce the stress of the whole thing that's going on for that family.
Right.
While in the midst of it.
Right. And, fully insured carriers have managers, right?
Right.
But they're managing those cases from only an expense perspective. Only to watch that profit margin, not as a concierge or advocacy.
Profit margin like it's bad to make profits.
Well, it's not bad to make profits, but if I can self-fund and I can have that profit, then that's what I want to do. I want to watch my money.
Right.
Yeah.
So the advocate, going back to that, is really a benefit to the member.
Right.
Because it's going to help stabilize their experience while they're going through a treatment program.
Right, and again, we're using quality metrics too. So
we're not going to send them to a veterinarian?
No, we're not going to send them to a veterinarian. But, quality metrics are important.
Yeah. So, Stacy, we've been talking a lot about change during this podcast episode. And with your experience and your wisdom in the industry you've been on the advisory side, you've been on the carrier side, you've been on the TPA side, and you've been on the plan sponsor side. Mm-hmm. So you have experience with working with a number of different types of advisors and consulting groups. So I think my first question to you would be do you see a difference in the marketplace between different consultants that you've worked with? Oh,
yeah, tremendously.
Okay.
So there's a lot of firms that just hit the easy button.
Okay.
So they would keep an employer fully insured year after year after year. They make more money. They get commissions, and it's easy just to roll it over. Right. So, there's firms that do that. I think we're a lot different because we like to get under the hood, as I say.
Right.
So we actually
be a little disruptive.
Yeah.
Not from the employer's perspective,
not from the employer's,
from the carrier perspective.
From the carrier's perspective,
right.
We challenge the carriers with the status quo all the time. I want to know what's under the hood. I want to know what those dollars are for. Okay. So we challenge them on the fully insured pieces. On the self-funded pieces and moving clients to self-funding, we're taking a deep dive under the hood. We're watching dollars that typical consulting firms don't watch. We watch every penny.
So what's your experience and, talking about differentiation is that, in the marketplace, there's firms like us, which I would consider that we're a small boutique specialist. And then you have firms that are multinational, you have firms that are national, you have firms that are regional. Do you see strengths in working with, smaller, more boutique that are focused firms versus, are there any benefits that can become from a larger, more regional or national firm? Do they have something that like an organization like us would not have access to?
The only thing that they would typically have are resources, but we've built that.
Right.
So we have the expertise and the knowledge, years of expertise and knowledge, and all the typical resources.
Right.
So actuaries,
Yep.
pharmacy experts, we have all of those people.
Compliance experts, ERISA experts.
So that's usually the differentiator, but we have all of that on our team.
Right.
And so we can support clients. I think the biggest thing about Arkwood and why I love being on the team here is that we take our clients and we treat them all like jumbo clients. So
Right.
we customize communication pieces.
Right.
We look at their dollars and their spend. We give them advice about their programs and where we're seeing those dollars. And we dig under the hood. We look at dollars that other firms aren't even looking at.
Right. Well, thanks again, Stacy. I appreciate you joining us on this podcast. That's it for now. We'll chat next time.